So today I'm going to be synopsizing what we know about what's been going on the ground, crazy stuff that's been going on in Wuhan, and what you can expect if this comes here. Not because necessarily the lethality of the virus itself, but because of the panic. So much of this stuff is happening because of the panic. While the mortality rate sits right now around 2.5%, which is of course still 25 times worse than the seasonal flu, meaning that if this became as pervasive as the seasonal flu, you would see 25 times the fatalities. But that may not be the whole story, as I'm going to talk about today. There was a gentleman who let a video out on LiveLeak, and I'm going to summarize some of what he talked about in this video today as to what is actually going on the ground. I believe that when the smoke clears on this, many lessons are going to be learned that are going to better prepare people for the actual big pandemic, which may be coming down the pike. In spite of what some people view as a mere 2.5% mortality rate, although some people debate these amounts, claiming that the death rate is much higher, if you've ever been to an emergency room on an average day and tried to get service, what ends up happening? Well, you're going to be greeted by a triage nurse who is going to tell you what your place in line is. And unless you're in critical condition, you're probably going to the back of the line. In the best of times, you're potentially waiting hours for service. So just imagine for a second that this bug infects even a small amount, let's say 10% of the population. That's around 3 million people in Canada and 30 million people in the United States. What this means is that you are going to see a 100-fold increase in people who need healthcare services. This is going to crash the system, and unfortunately we don't have a communist government that can move in there with sweeping draconian measures to put the entire compliant and obedient population on lockdown and bypass all the bureaucratic red tape and just do what needs to be done to remedy the situation. 9 times out of 10, I'll take a capitalist government over a communist one, but there may be some merits to having one when you're trying to contain a highly infectious novel disease. You know, in Canada right now, our healthcare representatives are gloating about their ability to deal with 2 or 3 cases of the coronavirus and keep those people quarantined and provide them the services that they need. But heaven forbid that something that happened in Wuhan happens here, because our healthcare system is so wrapped up in bureaucracy and red tape that I would anticipate a total collapse of the healthcare system. These hospitals are going to be short-staffed and they're going to be short on supplies. We've seen what happened to the inventory of global pandemic supplies when only one country, albeit the biggest country on earth, had an epidemic. That should give an idea of what the availability of these supplies will be if this happens on a global scale. Little to non-existent comes to mind. The hospitals are going to be swarmed with people who are ill and want to be diagnosed. Because people are going to want to be diagnosed, they're going to want the test kits, and that is what's happening in Wuhan, is that they had a limited amount of test kits. And based on what people are saying on the ground, many hospitals were turning people away because they had to keep the test kits for people who were terminally sick. If you didn't present at the hospital like you were ready to keel over and die, then you were probably not going to be tested because they only had a limited number of test kits. So what I'm saying is that the people who are being confirmed are probably the ones who are the most sick, and thus perhaps the fatality rate isn't as high as we think it is. What this does imply, however, is that the infection is probably out of control and China is just trying to hold it together until they can come up with a vaccine. There is new research which indicates that this virus is not only contagious during the incubation period, but even after, in what they call the convalescent period, where the person starts to get better. So there may be cases where people have been released from hospital and they are still shedding the virus. I'll post a link in the description if you want more information on that. There's a lot going on in Wuhan that I'm going to talk about in a minute, but that is what people need to grasp about the severity of a problem like this. It does not take much to overwhelm the adaptive capacity of your local healthcare system. It does not take much at all. And if we get to the point where we're warehousing sick people in stadiums or school gymnasiums that don't have negative air pressure and aren't proper hospitals, that's probably only going to make the problem worse. which is why China is trying to build special hospitals to deal with this, so they can have a red zone that they can quarantine all the sick people, and they can have yellow zones and they can have green zones. This is how they're planning on meticulously weeding out this virus until they can find a vaccine. Now, when I said that the biggest threat of these things is the panic, here's what you need to know about what's been happening in Wuhan. And I'm not saying this is happening in mass. These may be isolated incidents, but these are things that have the potential to happen. And I find this stuff by searching on the news and on YouTube, always by searching by upload date. That way I get the unfiltered internet. But be very skeptical of what you see, because there is a lot of disinformation online. So there are groups of people, I'm not sure if they're affiliated with the government, I've just seen footage of this, labeling certain homes as infected. So just like they did during the bubonic plague, the dwellings of sick people is being marked. There are clashes with police at what appear to be checkpoints, because remember, many of these cities have been quarantined and people have not been allowed to leave. The government in some places has literally deactivated the roads. If that doesn't speak to the level of excessive rule of law, I don't know what does, and it's surprising that we're not hearing about this more on the mainstream media. All we hear is that China has quarantined a city, but you don't get all the specifics of what's going on the ground. And some of this may be due to the fact that even the reporters there from Western countries are scared to go out because the panic is so great, and there's very few reporters who are willing to risk their lives to go out and get the footage that you need. But there is one, and I'm going to post a link in the description to that individual. Now, there's video footage of people going around coughing on medical staff intentionally. And if you know about what's going on in the hospital situation, where they're not willing to admit or test people unless they exhibit sufficient symptoms, perhaps that was why this person was frustrated. Now, I'm not at all saying it's justified. I think it is absolutely terrible for somebody to do this. But in the context of Wuhan health officials having limited supplies, we can see how this kind of frustration would build within people. And again, I do not condone that in any way, shape, or form. But there may be some sadistic people out there who use it as a weapon against other people. That's something you need to keep in mind. There's videos of lynch mobs in other Chinese cities because people from Wuhan now have become quite vilified. So there's an internal xenophobia brewing amongst the Chinese people against people from Wuhan. And if you're from Wuhan and you're in another district within China, I'm not sure if they're called provinces or counties or what they're called, but if you're from a different part of China and you have a cough and you're from Wuhan, be ready to face the lynch mob. There's video footage of people being swarmed and being accused of bringing the virus into their county. Just take note of this, because these are things that could potentially happen in your community when the actual big one hits. I'm not saying it's going to happen with this particular virus, but I'm just saying that that is something that could happen. Also, you should know that there's some video footage going around of alleged wet markets in Wuhan, and apparently that footage is actually from an Indonesian wet market. So just be careful about the stuff that you see. And even the stuff I talk about today, I can't guarantee that all of it is 100% true. It's just what I've observed in the independent media. And to me, it appeared credible. But that doesn't mean you have to run with it like it's the gospel. Now, there are some people who are refusing to wear masks. And if you refuse to wear a mask, people may single you out, as they do in a video that I'll post below. With all of this, we're going to see mass hysteria, mass groupthink, herd mentality, and people just losing their minds in spite of the lower fatality rate, which is still significant. I'm not saying it's not significant, otherwise China wouldn't be locking down their cities. But it appears that some of the hysteria is disproportionate to the threat, at least relative to the death rates that are being reported by the Chinese government. There was a video of a guy smashing a hospital window trying to escape quarantine. These are the situations that are going to arise. And just like in Venezuela, there's going to be a lot that we're going to learn from what has transpired in Wuhan so that we can project out to future pandemics. Maybe this one will turn into that. These RNA viruses can mutate viciously, and it could very well become a serious thing. But either way, pay attention to what's going on at ground zero. because that may be what's coming here next. But this is something for you to keep in mind also. As great as healthcare workers are for putting their lives on the line, I believe that these people who are working on the front lines in the hospitals are heroes, they're warriors, and they are deserving of the highest honors that a society could afford them. But we must also keep in mind that health workers are not infallible. And having worked in a health facility for the last 10 years, if you think that hospitals are kept clean and sterile, you have absolutely no idea. I can tell you that they're no cleaner than your average fast food restaurant. Now, I am certainly by no means discouraging people from seeking medical attention if you need it. But there may come a point where the hospitals are so overwhelmed that you'll have to take a serious look at your symptoms and consider whether or not it's worth it to even go there. And here's another problem with the panic and the placebo effect that happens when you tell yourself you have a potentially lethal virus. The anxiety of that alone is going to be crippling for a lot of people. Anxiety causes stress, and stress is going to cause the illness to progress. The placebo effect is the idea that the more you believe in a cure, the more likely it is to work. And the reverse is also true. If you are very pessimistic about your condition, that can have negative physiological outcomes. If it so happens that you get the coronavirus and these death rates don't change, remind yourself that you have a 98% chance of beating this, especially if you are a healthy adult. There is talk of many doctors being infected and many patients wanting to steer away from hospitals because potentially doctors are infected. Once again, this may just be a rumor. But there was an individual who made a report on LiveLeak, which is an excellent and very well translated first-hand account of what is going on the ground, and I encourage you to go and watch it after this video. I will post a link in the description. Hopefully that video doesn't get taken down. Now, he claims that initially the hospitals were quite full, but when people started to realize that they weren't going to get the help unless they presented as damn near terminally ill, they decided to stay home. And so he said when he was going around to different hospitals that they were actually quite vacant because the hospitals had few test kits. This is the reason why they're trying to build these new hospitals. So this is contrary to what we're seeing in the mainstream media. And I made a comment on a mainstream video yesterday because they were using footage from 2 weeks ago to try to explain what's going on the ground today. The same B-roll footage of a crowded hospital situation that's been floating around for 2 weeks. But we haven't seen any new footage. Now, he claims, this independent reporter claims that the doctors and nurses have been put on a gag order, essentially, so they can't talk about what's going on there. But perhaps why we're not seeing any footage is because a lot of people have given up on these hospitals. Now, we know that this virus is a credible threat that has the capability to be very lethal, especially in vulnerable populations where they have comorbidities, other health problems. And we know that China would not compromise its own economic output and internal stability if they didn't view this to be an existential threat. But it's yet to be determined exactly how lethal this pathogen actually is. The best case scenario is that this is going to be contained. It may spread to tens of thousands of more people, but it will ultimately fizzle out. The next scenario is that it's going to become a global pandemic that will only be defeated once they bring in a vaccine. And it may well just be the case that this is something we just learn to live with. The fact that some people are going to get the coronavirus, and that you're going to get your annual coronavirus vaccine like you do with your annual flu vaccine. And that may just be the first of many viruses of this sort as we become more urbanized and we continue to travel and circulate the globe at a faster and faster pace, facilitating the lightning fast spread of disease and illness. So my message to you on this topic, and I hope this is going to be my last video on the topic, but the way this thing is progressing, I'm probably going to have to continue to keep you guys apprised of my observations of the situation for whatever it's worth, and I certainly appreciate your comments in the comment section. One thing I will request you do is avoid any xenophobic comments on my channel. Just because a person is of Chinese descent doesn't make them culpable for the events going on, so stay prepared. Don't let the panic get to your head because it could make you act in irrational ways if and when you need most to act in rational ways. And remember that 98% survival is still pretty good odds. it may well turn out that the death rate is much higher. Even then, we mustn't lose our heads and find ourselves in a lynch mob trying to find someone to blame for the situation. And I'm not saying that the guy who was sick and potentially infected people wasn't a problem, but putting yourself in a situation like that is risky as is. Just like going to the hospital as soon as you get a tickle in your throat is going to be potentially dangerous. But that's up for you to decide. Stay ready, stay vigilant. Thanks for watching. Don't forget to like, comment, subscribe if you enjoyed the video. Canadian Prepper out.